Sure. So I do many types of transplant, but I would say that the liver transplant is probably one of the most fascinating and hardest transplants that we do. And if you think about it, what is the liver? The liver is essentially your chemical factory. It has 500 different functions in your body. You can't live without your liver. And so without a transplant, these patients have no options. The liver is the largest solid organ you have in your body, and it receives a tremendous amount of blood, and it's one of the most vascular organs that we have. And the reason why that's important, and as you saw repeatedly in the film, it's about the bleeding that can associate from the liver. On top of that, someone who has liver disease, the blood supply to that liver is even worse. The blood is under pressure, and so the blood can leak out from just about every vessel. So it's very difficult to operate on the liver, especially in someone who has liver failure. On top of that, someone who has liver failure just doesn't have liver failure. They're very sick to begin with because the liver affects your entire body. So their kidneys may be failing, their muscles are wasting. These are individuals that are very sick, and at a time that they're very sick, you're asking them to go through an operation that's about the largest magnitude operation that we do. If we get through all of that, and when we get through all of that, that's really just the beginning of their story, because then they have to get through the process of hoping that there's no rejection, that there's no infections, etc. And it's really a lifelong process after that. So you can see that there are multiple steps along the way, and multiple questions that are there in making liver transplant work. And what's so amazing about this field and about Dr. Starzl is that when he started this, all of those questions were there still. None of the answers were there. None of the answers were there to any of those problems, and he literally had to find all of those answers himself to make that possible.
Well, and it's interesting because now, I know Dr. Scantlebury, you're in a transplant center in Delaware, and they're all around the country and the world now, as opposed to when you started, the only ones doing livers really were in Pittsburgh with Dr. Starzl. And, you know, Dr. Humar will talk more, and you can also, the difference. But could you just reflect a little bit about what it was like? It seems like you were almost on the battlefield of the beginning era of modern-day transplantation. Give us a sense of what it was like in the operating room or just being around Dr. Starzl then, if you don't mind.
Well, as you heard in the film, in 1986 was when things took off, and that was the year I started my fellowship, and there were 10 of us. And we were doing over 600 livers a year and 400 kidneys, and so it seemed like you did nothing except went on donor recoveries, come back, scrub on cases, do back tables. And so when you had a chance to operate, it was really, and in my book I talk about being in a theater, because it really was like a theater, because you had all these visiting professors and surgeons from different countries sort of looking behind you, trying to stare into the field. In the adult hospital in Pittsburgh, they had a dome, and so you looked up and you almost could see all these folks, just like I see you guys up there, in this dome looking down on the operation. And so oftentimes as we were used as human retractors, as you heard, Dr. Starzl didn't like retractors, so we will be in the assistant number 5 or 6 squeezed between the drapes and those tiny patient's body, and he'd be asking you to do strange things that were impossible, but he knew it was impossible just to make you look like an ass. And to embarrass you. And so sometimes you go to take a break and come up and you hit someone in the chest or the head because they're leaning so far over you that you just felt that you were hunched over the whole time. And you want to say, can you just say, back off, you're my personal space. But, you know, especially when there was lots of body odor because we hadn't taken a shower in so long. But that's all you did. And so without the regulations, oftentimes there were, as we heard, 3-4 different coolers lined up in the hallway, and there were many cases going on at the same time. And you just came out and he goes, well, which organ is mine? And you look and you figure out, well, this is going to this room and this one is going to that room. And thank God it all worked out in the end. And so basically you lived and breathed that. I used to say, why do I have an apartment? To go home every once a week, but that was the life. And so you ended up, as Joy said, she didn't have to cook, but we had apartments, but we didn't see much of it because that was what we did in terms of, there were patients coming from so far, different countries. Everyone came to Pittsburgh to get the transplant. And And so we were the mecca in terms of getting the number of patients here and doing the transplants.
Well, that's really amazing that pioneering work, and thank you. Dr. Humar, so people don't get the impression that, there's so much blood in the movie where they would lose 300 units of blood on the patient and things, and that was early on experimenting. But what's the difference between how the transplant operations works now versus then? I know also now you do more live donor that they didn't do back then, but could you explain the difference between, those early days and today, and then maybe Dr. Scantlebury can also reflect on that.
Sure. So as I look back on the history of liver transplant, it's really only about 30 years plus old. It's remarkable how far liver transplantation has come in that period of time, how much it's changed, and yet then when you look back at in a sort of larger scheme, how much it hasn't changed. And by that, I mean, if you look at the results, we're dramatically better in terms of what the outcomes were. When liver transplants first started being performed, they were looking at 10-20% survival. Now the expected survival is 90% plus at most centers with a liver transplant. It's the expected form of treatment. It's the gold standard form of treatment. It's the only form of treatment that we have to offer a patient with any form of liver failure. The bleeding is still an issue, but I look back on cases that we've done. In the last year, half of the cases that we didn't even transfuse the patients during surgery. We were able to do that. And that's not because we're any better than that, but we've learned how to do the operation better. We've learned how to manage these patients better. Our drugs are better. The rejection rates have gone down significantly compared to previously. Our antibiotics are better so that we don't see the degree of infections. And so yes, we've definitely come a long way from when it was an experimental procedure to something that's become the gold standard treatment in that period of time. But as I look back, and especially as I'm watching this, I see how things have not really changed in that. What were the main problems then, and what are still the main problems? The main problems were that we didn't have enough organs for all the people that needed them. And we still don't have enough organs for all the people that we need them. We're looking at various ways, and we'll talk a little bit more later about the ways that we're doing to try to improve or increase the number of organs that we have available for patients, so less and less patients are dying, whether it's using machines to help preserve livers better, whether it's using livers that we wouldn't have done before, or whether it's using live donor liver transplants as a way to increase the number of transplants. And the other thing, and this was always, I remember speaking to Dr. Starzl many times, this was really the foremost thing on his mind, was that while we were helping patients, at the same time we were poisoning them. And he realized that better than anyone else, that to make a transplant work, you had to poison the patient to do that. And that was the anti-rejection medications that without them the transplant wouldn't work, but nonetheless they worked by suppressing the immune system, one of the most important parts of our body. And that's why the patients were at higher risk for infections and tumors and various other problems. And so that was one of his lifelong goals, was to try to figure out how could we do transplants without the need for these long-term anti-rejection medications. And we're continuing that work with various different methods that we're trying. At the present time, we're looking at immune cells that Dr. Starzl was talking about, something called dendritic cells that we take from donors prior to a transplant, cultivate them, and then give them back to recipients before the transplant in a live donor model, so that the recipient is signaled as to what is a friendly organ coming in and doesn't hopefully need long-term anti-rejection medication. And those trials are just underway. We've enrolled the 10th patient just recently in a trial that we're doing, looking at that. And I don't know if that'll be the future of transplant, but it certainly is very exciting. But one other thing that really hasn't changed with transplant in all this time, and that's the miracle of transplant. Transplant was a miracle at that time, and transplant still is a miracle. And if you think about it, people had talked about it in the movie, families being asked to donate their loved ones' organs at the most difficult time in their life and making that selfless decision. Or live donors, donors that essentially come in and say, look, I'm healthy, I have 2 kidneys, take one of them. Or I have a healthy liver, take half of my liver and give it to someone. Really, for the only reason was to help someone else, because it wasn't helping them. And when you see that, you realize what a miracle transplant is, and we are so fortunate to be in this field because we see that miracle every day.
Well, and that's what's been gratifying when people see Dr. Starzl's story. I think people don't still feel that. So I have two questions for you. First of all, it should be fascinating because you have not seen the movie until now.
Yes.
And the people who will be watching this, some of them won't even know who Dr. Starzl is. So if you want to have any reflections on what it was like to work with Dr. Starzl, but also some reflections on when you watched back then, you really were going through, it's like watching old episodes of MASH and thinking, wow, that, you know, and now your life is probably very different. So could you talk a little bit about, you know, any reflections you have of Dr. Starzl, especially seeing the movie, and then, you know, what your life is like today and what the field of transplantation is like today. And then we'll end by talking about the future.
Well, as I saw, it was very interesting for me. It brought back memories, and I have to say he was a taskmaster. I mean, that, to put it mildly, he was a taskmaster. It was grueling. He wanted rounds in the middle of the night. He would come get you, and we'll round at 11 or midnight. He expected the best from you, and he was always, it's almost seemed, you look at him and it was like if you could see his brain turning over. He was always in thought, deep thought about what was the next thing that I should do, or the next experiment, or what should we study next. And so for us, it was that he was a drill sergeant in terms of getting things done, moving on to the next level, making sure we did it right. And one of the things I was fortunate enough to go on him when he was really advocating the Starzl way of removing organs. And it was what we used to say, this is snatch and run, in that you go in and instead of spending a lot of time dissecting the donor in the donor operations, you just quickly clamped and removed the organ and be on your way. And that was different from what some of the other centers were doing at the time. And so it allowed us to learn a different technique. And so as you went out and as we multiplied from year to year, as more and more fellows came and went on, came and left, we went off and started our own transplant centers, and many left, but there was that division. If you were Starzl trained, then you did it one way, and if you were trained elsewhere, then you did it another way. And I think it was a learning experience because at that time there were many different surgeons here at the university, and so you learn many different techniques, and you're able to take that knowledge and that grasp for more knowledge and understanding and more research to the next level, because you always had that zest for learning. And I think one of the challenges, as we would say, transplantation is still a miracle, and we've gone from 30 years ago having 30 or 40,000 patients on the list to now having over 120,000 people waiting for transplantation. And so the demand is still great, however, the supply just isn't there, and it's really working to continue to have this gift of life available and really educating our communities and still spreading that word so that we can have more and more donors. And I think that's probably one of the biggest challenges we have. We do have the ability to work on experiments and more studies to be able to, I think when Dr. Starzl was doing the stem cell transplant and taking the cells from the donor to he really thought that was it. This was really going to take us to the next level where there would be no need for immunosuppression. And there were the trials where he withdrew patients, so withdraw the immunosuppression to see how they would do. And it worked for some of the liver patients, but not so good for the kidney patients. And so that didn't turn out to be the way it was going to be. And so we're now moving to a different level, but the scarcity is still there, and we still need more organ donation.
It's almost even more frustrating to hear both of you talk because so much progress has happened. And I know when you were starting this, they have sirens, and when you went to go get an organ, it was the news, and the mayor would be there, and all these things. And now it happens every day, and it's almost shocking to hear that the list is longer, not shorter, and with all the breakthroughs. So if you could just speculate, last, and then hopefully we'll have a couple time for one or two questions. But if you could speculate, if you could wave a magic wand, Dr. Starzl did the first successful liver transplant in 1967, and then all the years to get here. What do you think it'll be like 20 or 30 years from now, or even more shortly in the future? If you both could just talk a little bit about that, and then if you have questions, we'll take a couple from the audience.
Sure. So, as I said, I think the main problems that are facing transplant are still revolve around organ donation. And that Dr. Starzl saw a long time ago. And I had several discussions with him about this. as to how we could alleviate those organ problems. And I think that those are going to be the challenges. Now, one of the philosophies that we've adapted here at University of Pittsburgh has been the use of live donor organs. And live donor liver transplant is a relatively newer field, only really in the last sort of 15, 20 years that we've been doing this. But the possibility of taking part of an organ from an otherwise healthy individual and transplanting that, and that can have profound impact, because if you look at the way that liver transplantation is done at the present time in this country, is that you have 14,000 people that need a liver transplant. We do 8,000 liver transplants a year. So unfortunately, there just aren't livers for all of the people that need them. And that's really just what I call the tip of the iceberg, because there's no point increasing that list to 30,000, though we could very easily. If you wanted to put every single patient that could be helped by a liver transplant, you could very easily make that list up to 30,000. But why make it 30,000? You're still only doing 8,000 transplants a year. And so what it means is that these patients wait longer and longer, because livers are given by your level of acuity, so you have to get very sick to get your transplant. There's a 20% chance that you're going to die before you get your liver transplant. That number is very stark and very real that we have to talk to every patient about. That every time we put a patient on the list, I have to tell them, look, there's about a 25% chance that you are going to die before you get to your liver transplant, because that's just the reality. And it's important that patients know this reality. And so live donor liver transplant for us has become an important way to try to offset this, because we can, A, transplant patients before they get that sick, avoid that risk of waitlist mortality, and potentially help all of those other people that didn't qualify to be on the liver transplant list. So that may be one way that we're going to try to do it. There are other ways that are coming down the pipeline, using machine perfusion perhaps to try to preserve organs that we can't use at the present time, to improve them, to make them transplantable. That might be another way. Using organs from sources that we wouldn't have considered, i.e. can we genetically modify a different species, either a pig liver or some other species, and make it look more like a human liver so that we can transplant it.
I know Martina Rothblatt in the movie is actually pretty close to growing livers or organs in pigs. So. Dr. Velma, Dr. Scantlebury, if you can just reflect, and then if anybody has a question from the audience, we'll go to that. We have about 5 more minutes left. So.
Well, I think one of the things is certainly moving forward. Years ago, Dr. Starzl was looking into genetically modified pigs, and I know University of Alabama, Birmingham, they are moving towards that direction in terms of looking at having those pigs ready, hopefully, I don't know, in the next 5 years or 3 or 2, I'm not sure, but that certainly would allow for supply. But I think one of the things we need to do really is about things like this: educating our communities, educating our everyone, to put it on your radar. When you talk to patients, our families, or even in terms of going out to do education, it's not on their radar. They don't think about it unless there's someone in their family who suddenly needs an organ, and now they're thinking about need for organ donation and how it affects whether their family member will live or die. And as you said, people will die waiting for organs. So I really do think that it's upon each and every one of us to really begin to spread the word and to educate one other person. If you can get one other person to consider living donation or even deceased donation, but living donation certainly, we all have 2 kidneys. Maybe God give us those to see if we were going to be generous enough to give one up, since you only need one. So that's my last thought.
I was going to end with a plug about registerme.org. You can just go there and register. Next year, we're hoping to use the Burden of Genius movie for a contest with high school students nationally to try to get them to make, movies in their own schools, because people don't understand the miracles, like you say, until they. I know you have some patients here, probably both of you in the audience or something, but does anybody have any questions? So let's get one question in. Yes, you.
So both of you obviously learned a lot from Dr. Starzl from a technical and surgical aspect, but what did you learn from like a personal, human, emotional aspect from him?
Well, let me just repeat the question. That was an amazing question. So all the technical aspects, if you could just reflect on what you personally learned from Dr. Starzl, each of you, that's a great way.
So I feel very fortunate, actually, because I came to Pittsburgh about 10 years ago. I never had the opportunity to work with Dr. Starzl when I was in training. I only got to see him when he was removed from the clinical arena. And while he may have been a taskmaster and all of the tough things that you heard about that were so necessary, I saw a very different side of Dr. Starzl. He was one of the warmest individuals that you could meet. He would come and sit in my office and we would chat for hours. And he would just ask me about how things were going. He was always very sharp, so he would always talk about the things that we could do to make it better, but it was in such a warm and embracing way that it made me feel so comfortable being there. But the one thing that I learned most about from Dr. Starzl is that he knew everyone, and he knew everyone, whether it was his patients, whether it was the other doctors, whether it was the coordinators, whether it was the person who cleaned his office. He knew them by name, and he treated them all equally. They were all the same for him. And really, he was not concerned about any airs of superiority or grandeur. To him, it was really just about helping other people. And that came across very clearly when you talk to him, and that was an important thing that I took away from him.
This gives me a great excuse to have Dr. Scantlebury repeat, if you remember, the anecdote in your book about when you first came here for your interview and he offered to treat you for lunch. You want to share that story, and then anything else you have?
Well, I had interviewed, I really wanted to be a pediatric surgeon, and so as I interviewed here, I met and was interviewed by Mark Ravitch, who then, we had a very casual interview, and basically he said I needed more research, and what a great opportunity would be for me to come back to University of Pittsburgh and do my research in transplantation, because I had 6 or 8 months of research in transplantation. That was not enough, and so he invited me. He said, I'll talk to Tom and you come on down. And so I came back for my interview for Tom, with Dr. Starzl, and so he took me to the cafeteria, and he bought lunch, actually. We got a tray, he got 1 piece of chicken breast, a container of 1 serving of peas, and 2 small Shasta sodas, ginger ale. So I figure, and 2 plates, so I figure, okay, we're splitting this meal. So he did, and so he divided the chicken breast, and I swore he counted the peas, I had said this in my book, and splitted them evenly. I was going to say, what if there was an odd number, who'll get the last pea? But anyway, I had my own drink, and so we had lunch, and we ate, and we talked, and he said, well, if Mark says this is what you should do, this is what you should do, fine, you're hired. And so we went up to pay, and so he's checking his pockets for money, cards, and you hold this for me. He goes, oh, can you put this on my card? And the cashier said, hell no, your bill is so high. You haven't paid your bill in months. No, you're not. We're not putting this on your card. You have to pay cash. And so obviously he goes, I don't have any money. So can you pay for this? So yeah. So that was my first interview, my visit to Pittsburgh, and I ended up paying for lunch, splitting a chicken breast and a serving of peas.
I don't think we're going to get any better than that, so would you mind if we just, I know there's a lot more to say about Dr. Starzl, but thank you for sharing that, and thank you, both of you. I mean, the amazing thing about transplant doctors is not just what they do, but over and over again, everyone who's been in Dr. Starzl's orbit that I've gotten the privilege to know, and the filmmakers who work with me, you guys are among the most amazing.
Just to answer your question, one of the things that I saw in Dr. Starzl was that he was persistent, and I learned that there are people who are going to object to what you're doing, as I call them, the naysayers, or the people who are going to say you can't do this and you can't do that, and throughout my career I've had those obstacles. And I learned that if you keep your focus on what it is you want to do and that you're passionate about, then you dismiss all that negativity and you keep your vision on what it is you're determined to do. And so I learned to be more determined and to be passionate about what I want to do and not let others pull me down.
Well, thank you all so much.